Now, I want to tell you about a patient I'll never forget. She was 74-year-old, a retired teacher. Her daughter brought her in because she has been a bit forgetful lately. So we ran the usual checks, blood pressure slightly elevated, but nothing alarming. No diabetes, no atrial fibrillation, no smoking history. On paper, she looked fine. But when I asked her doctor one question, does your mother snore? The doctor laughed. Said, doctor, she snores, she sounds like a motorbike. Then she paused and added, but she also stopped breathing sometimes. You see, we always thought it was normal for old people. So 6 months later, that woman had a stroke. Not because of her blood pressure, not because of her heart rhythm, but because of what was happening every single night while she slept. And nobody has taken it seriously. Not her family, not her previous doctor, almost not me. Now, let me address the biggest myths I hear in my clinic almost every week. So, doctor, snoring is just snoring. It's annoying, not dangerous. And besides, old people snore. It's normal. I understand why people believe this, but snoring has been normalized in our culture. We joke about it, we sell notes strip for it, we make sitcoms about it. But I need you to hear this clearly. Severe obstructive sleep apnea, where you stop breathing repeatedly throughout the night, is not normal at any age. And in the older adults, it can be quietly and invisibly dangerous. Here's what the science actually says. I'm going to walk you through two landmark studies so you understand exactly what we are dealing with. Now, for the first study, the Victoria Sleep Project in Spain, the researchers in Spain followed 394 elderly individuals up between 17 and 100 years old for full 6 years. They measured each person's sleep using full polysomnography, which is a good standard overnight sleep study we use to count exactly how many times a person stops breathing per hour. They call this the apnea hypopnea index or AHI. A score of 30 or above means you are stopping or severely restricting your breathing at least 30 times per hour. That is once in every 2 minutes all night long. What did they find? After 6 years, people with an AHI of 30 or more had a 2.52 times greater risk of suffering an ischemic stroke compared to those without severe sleep apnea. And this was after adjusting for high blood pressure, diabetes, atrial fibrillation, smoking, and cholesterol. The sleep apnea risk stood completely alone. Let me be direct with you. You see, this was not a small hospital study. These were real community living elderly people. People like your parents, like your grandparents. The ones with severe untreated sleep apnea were 2.5 times more likely to have a brain attack. Now, the second study is the interstroke study and is international. So the second study is even more powerful. In fact, it's one of the largest international stroke studies ever conducted, called Interstroke. Interstroke enrolled over 4,496 participants across multiple countries, comparing people who had just experienced their first stroke with matched controls. They did not just look at the sleep apnea, they looked at the entire spectrum of sleep disturbance, which includes the duration, the quality, the napping habits, snoring, snorting, and breathing cessation. These findings were extraordinary compared to people sleeping 7 hours. Those sleeping fewer than 5 hours had over 3 times the odds of stroke. Those sleeping more than 9 hours had nearly 2.7 times the odds, and people with symptoms of obstructive sleep apnea, snoring, snorting, or an observed breathing cessation had up to 2.87 times increased odds. But here is the dictate that truly stopped me when I read it. You see, the researchers developed a sleep disturbance symptom burden score. People with more than 5 concurrent sleep symptoms had a staggering 5.38 times greater odds of stroke, not 50% more, not double, 5 times. The more sleep problems you carry, the higher your risk climbs. And this is what the scientists call a dose-dependent relationship. And it is one of the strongest signals that this is not a coincidence. Sleep disturbance is genuinely driving stroke risk. If this is already making you think about someone in your life, a parent, a partner, or a grandparent, please hit that subscribe button right now, because every week I bring you exactly this kind of evidence-based medical insights explained in plain language directly from the clinic. Subscribe and let's keep each other informed. So why does sleep apnea cause stroke? Now, as a doctor, I want to explain the mechanism, because when you understand why, You will never again dismiss snoring as harmless. When you stop breathing during sleep for even 10 to 30 seconds, your oxygen level drops, your body responds by releasing stress hormones, adrenaline, cortisol, your heart rate spikes, your blood pressure surges. This happens not once, but 30, 50, sometimes even 80 times per night. And over the weeks, over months and years, this creates a perfect storm for your blood vessels. The repeated oxygen drops cause inflammation in the vessels wall. This constant blood pressure spike damage the linings of your arteries supplying the brain. So blood starts to thicken, clot forming particles become more active. Then one morning, sometime with no other warning, a clot formed or a vessel rupture in the brain. So what the patient feels as waking up a bit of is actually a stroke. And we trace it back and we find the culprit has been there for years, even every single night. This is also why the interstroke research have found that stroke were strongly associated with waking time. The stroke often happens in the early morning hours, precisely when sleep apnea events are most concentrated. Now, here is a piece of information that neither of the two research papers covers, and I believe is the most important thing you need to take away from this video. We know sleep apnea causes stroke, but can treating sleep apnea actually prevent them? A landmark study by Marine and colleague published in the Lancet followed over 1,500 men with severe obstructive sleep apnea across 10-year period. They divided the participants into those who refuse treatment, those who use CPAP therapy consistently, and those who use it inconsistently. The results were remarkable. The men with severe sleep apnea who use CPAP therapy consistently had cardiovascular event rates, including stroke, that were comparable to healthy men without sleep apnea at all. Their risk essentially normalized. CPAP means continuous positive airway pressure and is the machine that delivers gentle pressured air through a mask to keep the airway open all night. I know many of my patients find it uncomfortable at first, but I understand. When I show them the data, something changes. Here's my clinical pro tip, the one I use in my practice every week. If you or someone you love is over 65 and snores loudly, gaps during sleep, wake unrefreshed, or nap frequently and unplanned, request a sleep study, not next year, this month. In my clinic, I use a simple three-question screen called the Stop Bang questionnaire. Do you snore loudly? Do you feel tired even after a full night of sleep? Has anyone ever seen you stop breathing during sleep? If the answer to any two is yes, I refer them for polysomnography the same week. Early detection and treatment of sleep apnea in elderly patients is one of the most underutilized stroke prevention tools available to us, and it is accessible right now. So what must you do right now? Let me speak to you not just as a doctor, but as someone who has sat across from families in devastated silence after a preventable stroke. Please take these steps very seriously. First, tonight, listen. If you share a space with an elderly parent, a grandparent, or a partner, pay attention to how they breathe. Do they snore loudly? Do they sink to gasp? Do they stop breathing for moments? Write it down. Then, secondly, evaluate the sleep duration. Are they sleeping fewer than 6 hours or more than 9 hours regularly? Both extremes are now independently linked to stroke risk. This is not about lifestyle preference, it's a medical signal. Then, third, check for daytime symptoms like unexplained fatigue, frequent unplanned naps, difficulty in concentrating, morning headaches, irritability. These can all be signs of disrupted nighttime breathing. Then fourth, speak to a doctor about a referral for a sleep study. In many countries, home-based sleep testing is now available. It doesn't require a night in a hospital laboratory. It is simple and increasingly accessible. Then, fifth, if a CPAP device is recommended, give it a genuine trial. Modern devices are quieter, smaller, and more comfortable than those of a decade ago. Most patients who persist through the first 2 to 4 weeks of adjustment report transformative improvement in energy, in memory, and mood. Do not let sleep apnea become chef diagnosis, something written in a file and forgotten. Treat it with the same urgency you would treat high blood pressure or diabetes, because the evidence now places it in exact that category of seriousness. So what have we learned today? So let us bring this full cycle. Sleep apnea is no longer a private inconvenience. In the elderly population, severe sleep apnea independently double your risk of ischemic stroke. The broader the range of sleep disturbances you carry, the higher that risk climbs. all the way to more than 5 times the normal rate. The good news is this: sleep apnea is diagnosable and treatable. And when treated consistently, your risk of stroke can return toward normal. So my patient, the retired teacher I told you about at the start, I often think about her. She represented a window of opportunity that was missed. I do not want that window to close before anyone watching this video. So if today's video made you think about someone, take action. One conversation, one referral, that one action can save a life. Thank you for watching this video, and if this was helpful, please like and share it, and don't forget to subscribe, because the person who needs to hear this most may be sitting in someone's living room right now, tired and undiagnosed. I am Dr. Emmanuel Bale. Stay healthy, stay informed, and I will see you in the next video. Thank you.